Good evening, everyone. My name is Diego Lima, and tonight I have the pleasure, I have the honor to have here with us two very special people for me, Dr. Samir Desai and Dr. Bruno Lima. I'll let them introduce themselves, but they are, at least for me, they're role models, and I have learned a lot directly and indirectly from both of them. And I had the pleasure of meeting Dr. Desai last year and his wife, Dr. Kata. And also, I have the pleasure now of being friends with Bruno. We are not from the same family, despite the last name. We have my last name is Lima as well, despite we put here like Laurentino. But Dr. Desai, Dr. Lima, thank you so much for being here tonight. We are going to have a very interesting discussion about the USMLE and the match. And I'm eager to hear from you, to learn from you too. I'm here only to guide you too. I'll just guide from different topics, but thank you for being here. And I like you to, like we do in our podcast, to tell like the most common question or that people say on interviews, like, tell me about yourself.
Yeah, so I'll start. And thank you, Diego and Bruno, for inviting me to join you here today. It's an honor and a privilege to be with both of you and our entire audience. To give you a bit of background about myself, so I'm one of the professors of medicine at the Baylor College of Medicine in Houston, Texas. And I've been there now for about 24 years. And I am what you would call an academic hospitalist. And my specialty is internal medicine. And so as one of the core faculty members at Baylor, I work very closely with our internal medicine residents and our Baylor medical students. And my passions are in teaching and mentoring. They've been passions of mine for a long time. And so I have the pleasure to be able to mentor and teach a lot of learners, and I've done that for over 2 decades. And what I try not to lose sight of is what it's like to be a student or a resident. I remember very well what it was like for me. And so I know that my students and residents today are facing some of the same challenges and sometimes new challenges. And I really enjoy helping them reach their goals and overcome those challenges. I have done a lot of research in several specific areas. My interests are in how to maximize learning during clerkships and rotations, and how to be successful in the residency match. And so I speak about these topics at different institutions across the United States. I also write extensively about these topics. I've written a series of books. One book is called Success on the Wards. Another book is called The Successful Match. These are 2 books that many U.S. medical schools have found useful in their education of their students to either help them make the most of their learning opportunities in their U.S.-based rotations, or to put themselves in a strong position for match success. And another area of interest that I have is making sure that all of our future physicians have the opportunities to reach their goals and have quality experiences. And about 5 years ago, when I realized that it was becoming harder for international medical graduates to find and secure quality US clinical experience, I wanted to do something about that. And since it was getting harder and harder to find that in US academic medical centers, I created an organization called MD2B Connect, where part of what we do is to connect international medical students and graduates with quality clinical experiences in the US under dedicated mentors and teachers. And so as part of MD2B Connect, we're in 30 different cities. We have about 175 physicians in many, many different specialties. And so I've been excited to do that over the last 5 years. And it's been a blessing to work with so many people around the world. We've had learners from over 60 countries, including many learners from Brazil. And what makes me very happy is being able to get to know all of these people and to see them succeed and to celebrate with them on match day when they say, Dr. Desai, I did it.
Yeah, thank you so much, Dr. Desai, for being here today. My friend, Bruno, please
Yeah,
tell me a little bit about yourself.
yeah. Thank you so much, Diego. First, it's such an honor, to be here with Dr. Desai and Samir. We ended up getting to know each other, for these past almost like 3 years now, since the beginning of the pandemic. A little bit about my background. I'm an MD PhD from Brazil, so I'm a international medical graduate myself, and I've pretty much learned a lot and a great deal of the process of the nitty and gritty part of the process, from some of Samir's books, especially the Successful Match, and also from my mentors. Coming from Brazil, I had the chance to do a few away rotations back in 2009, at Johns Hopkins with Dr. Roy Zirgasin, cardiologist who became a longtime mentor, the Brigham Women's Hospital with a few people like Dr. Pat O'Gara, who is like a legend in cardiology, and some other cardiology attendings that helped me guide through the process of coming here to the US. After I attained my PhD in 2014, I matched at the University of Pittsburgh Medical Center. They have a program that is called IST, International Scholars Track, in which they have about 6 positions. My time, it was 5. Now they expanded to 6 positions every year. Among the 45 categorical positions that they have every year, 5 to 6, they are international medical graduates with a really strong research background. And I was really fortunate, to spend, 3 years there. And I had amazing mentors. Among, the mentors that I had, my one of my program directors, who's now in Colorado, Dr. Shanta Zimmer, she's Vice Dean for Education, Colorado. Dr. Bruce Roman, who was also kind of one of my longstanding mentors, research mentors. Among others, Dr. Samir Saba, and I can list, a great deal of them. From Pittsburgh, which was a program that really prepared myself, for my cardiology fellowship, that was extremely competitive, especially because I was under an H visa, at that time. It just is like the bacteria, the multi-resistant, bacteria, programs, they are not happy, sponsoring H visas, especially for cardiology fellowships. Some of them, they get funded, from the NIH, as well. But I was fortunate to be very well prepared, at Pittsburgh, had great mentors, and I was able to pre-match at Emory University. I got a pre-match, offer there. And I ended up signing with them. I spent, I did a 4-year program there of cardiology. Comes, in 2 flavors. They have like 3 years of clinical cardiology and 4 years, like two clinical and 2 research. So I did that, worked under the mentorship of Dr. Viola Vaccarino. Continue doing, what I did with Dr. Roy Zirgasin and what Dr. Bruce Roman, but in a more mechanistic, in a way, trying to find this connection between like the brain and the heart, how mental stress causes heart disease. And that was a big question, that followed me, throughout my years, and try to find both like, the brain mechanisms, but also like the inflammatory, connection there and so forth. So I was able to publish, more than 50 publications in well-reputed journals, including JAMA, JAMA Cardiology, Circulation, and, Annals of Internal Medicine, and so forth. And because of that, because of the research, that I did, I was fortunate enough, to be awarded with a green card, for aliens with extraordinary abilities. And finally, after those 7 years of training, I decided to spend 2 more years of training, come to the best cardiac imaging program in the country at the Brigham and Women's Hospital with the best mentors in Dr. Marcelo Di Carli, Dr. Ron Blankstein, Dr. Raymond Kwong, and learn and get level 3 training, which is like the maximum that you can achieve in cardiac imaging on echocardiography, including structural echo, cardiac CT, cardiac MRI, nuclear cardiology, and vascular, imaging and so forth. And I was really happy here. I'm about, to finish up, by PGY 9 year and start as faculty at Vanderbilt University as an assistant professor there in August. Most importantly, throughout my path, I always try, to share, and I always try to pay. I could never pay back Dr. Desai or Dr. Roy Zirgestein or Ron Blankstein or Marcelo Di Carli or any of my mentors. So what I did was I pay it forward by passing on, some of the insights and some of the information that I got throughout my path, and helped almost 200 Brazilian and among other physicians, some other South American, physicians, some Syrian, physicians who are now, either residents. Some of them, they are successful faculty, members at some of the most well-known universities all over, the U.S. And I was able to help them, at an early stage and share with them, some of my insights that I gained from people like Dr. Desai, who's here with you. And that's it. A little bit long, but
thank you.
Yeah.
Thank you very much, Bruno. It's a pleasure to be here. I'll just talk a little bit about my background so we can move forward. I'm Diego Lima. I did my med school and residency in general surgery back in Brazil. I'm from Recife, Pernambuco in the Northeast. Also did my master's there, and then I moved to the US to work as a research associate here in New York. So I did it for 2 years, and then I did my steps and applied for the match and matched here at Montefiore Medical Center in New York. Now I'm a PGY 1 resident, soon to be a consult resident. I'm waiting for that. So I was always interested in research. When I was a medical student in my last year of med school, I did my surgery clerkship back in Japan. This was 2011. And if you remember, in 2011, we had the earthquake in the Fukushima area and the power plant accident. I was there during the earthquake. Had to come back to Brazil a week later, but always wanted to come to the US, and research was always I was always interested. I don't like saying numbers, but let's say that I'm getting to my publication number 100 soon, and even as an intern, I still try to do research, something that I love. And for Brazilian students, my wife and I, we will be publishing our research book with Editora Ateneu probably in the second half of the year. But let's start our discussion. So I have some topics here so we can discuss about the USMLE and the match. But the first topic would be how to build a strong CV as an international graduate. CV is not just about scores. Step 1 is pass or fail. Step 2 CK would be the only objective kind of step that the programs have to evaluate applicants. But what do you think about, for an IMG, what is really important to have a strong CV?
Absolutely, Diego. The CV is so important in the residency selection process. Now, the evidence for that comes from many different places, but two documents that I will encourage all of you to become familiar with are both available on the NRMP website. So these two documents are the NRMP Program Director Survey and Charting Outcomes in the Match. And there is so much valuable information in these documents about the criteria that program directors use to make, number one, decisions on whom to interview, and number two, on how they use the criteria to rank their applicants on the rank order list. And what you're going to see when you visit these documents and become familiar with them is that your volunteer experiences, your extracurricular activities, your involvement in leadership, the work you're doing in research, all of that matters to residency programs. There's a belief that it's all about the USMLE, and the USMLE is important, but it's one part of the equation. And there's been a movement in the US to push the selection process into what we call a more holistic review, where we're trying to look at all of these factors, because all of this is so important in our future doctors. And so what I would encourage all of you to do is to explore these areas, because there's so much meaning that we can get from volunteering in our community, from getting involved in an organization and taking on a leadership role, from furthering the understanding of our disease through the research that you do. Those things really give us a lot of energy depending upon our individual interests. And if you follow those passions, they strengthen your CV and they make you a stronger residency applicant. And those are things you have to come and keep in mind as you think about how to build the CV.
Nice. Very nice. One thing that I love about your books, I read both of the Successful Match and also the Success on the Words, is that it's completely data driven. You looked for the data so you could kind of build, your hypotheses and and everything, and you could say to the students and to the doctors, like, not just an opinion, but based on what has been published in the literature. This is really nice. Bruno, how can you build a strong CV being an IMG?
Yeah, I think first, what Samir mentioned about, checking for each specialty. It's first, you need to see where you are, okay? So you need to see if you're like, a medical student, or if you are a more like, seasoned, attending in your own country. This might vary a little bit. If you're like a medical student, you need to find out, what you like, what you're gonna invest your time on. Unfortunately, we only have 24 hours in a day. And although I believe, that the charting outcomes, it's a great start, for you to go there and see historically, what the programs, look at in terms of numbers. It doesn't tell all of the story. Over those years, more than 10 years, I've been listening to all kinds of stories of success, but also, stories of failure. And I think that, in the cases in which people failed in achieving their dreams, it's because they either gave up, they figure out life happens, there's like different reasons. But, something in common is that they didn't find like an identity, so it's like that old say, by Socrates, that said that an unexamined life is not worth living, right? So you need to see where you are, you need to see where you want to go, and then try to build your path. And not like every volunteer experience might be important, for you to achieve your level of, or to go to where you are. Everything might have some importance. Most of things might have beneficial implications, in terms of your personal growth, but not necessarily, this is gonna help you go from where you are, like in Brazil, South America, India, China, to a residency program in the US. So first is, after you decide, what I want to do, what I want to be, look for some role models, from people that came from your same med school. If you don't know anybody on your med school, see somebody from your own city or own country. And there are, like, several reports online, or people that just post online on different groups. And that was part of the thing that I did during those past 12, 13 years. I created, like, this group called USMLE Brazil, in which a Brazilian medical student can just kind of go there and type, well, what about radiology? They type in the group, and there's, like, a bunch of reports of people that matching radiology, and they're just tell voluntarily their experience. So that's a good blueprint, so you can try to follow, like, their same steps, and see, oh, so and also try to touch base with some of these people, and see what would be, like, good insights for more competitive applications, like radiology, or general surgery, or some of these some of these specialties that are more competitive. They sometimes require you to build up, like, a good networking, so you can have people to put up good words, and you can, like, maximize your of getting more interviews. But also you need to put up the work in order to have, like, the scores, have like, the publications in the area that you would like to apply for, and with that try to connect the dots and create a story that will be appealing for the programs, and that will make them interested in getting you, who are at this point just a piece of paper, and invite you for an interview, so they can get to know you as a person. So that's my approach, and that's how that's kind of what I've learned, that kind of work for me and for many people that I've voluntarily advised, in those past almost like 10 years.
Nice. It's like when you mention that you have to create, like, the path, like it's like a hero on a mission. It's like the path to your residency. It's not like your research. It's not like doing different kinds of research in different areas. You need to tell a story, your interest. So if you're interested in surgery and you like research, you're probably going to end up doing more, projects on general surgery. And this tells a story to program directors and to the leadership of the programs. And one very important part of the CV and is the clinical experience. A lot of students and doctors, they come to us, they come on Instagram or other social media asking about how to get observerships, externships, clerkships, and it's a very important component of your CV. And these will end up with with the letters of recommendation. And since the COVID pandemic, it's been difficult for students and doctors to get this experience. Most programs probably by now they reopen their programs for internationals visiting physicians or students. But I like you to explain to the audience these different types of experience that are available, how an IMG can look for it, and once the IMG is there, what are the tips for this student or doctor to have success once they are there in the rotation?
So with regards to US clinical experience, if you are a current international medical student then I would really encourage you to explore options to do clerkships and or electives at academic institutions in the US. So international medical students have much more opportunities than international medical graduates with that in mind. So there's an easier path to get hands-on US clinical experience for international medical students in academic institutions. So if you're currently an international medical student, this is something to explore. And some medical schools have established relationships with medical schools in the United States. Some schools are part of VSLO, which allows a more easier path to securing those types of clinical experiences in the US. So that is something really to keep in mind, because once you graduate, then it becomes very difficult to secure hands-on clinical experiences in academic institutions, like, for example, where I am at the Baylor College of Medicine. And that is what is ideal, is if you can secure a hands-on clinical experience in an academic institution. Now, if you're an international medical graduate, that doesn't mean you have no options for hands-on US clinical experience. You can still get clinical experience in different ways. At the academic institutions we are referring to, international medical graduates are generally only able to take part in what we call observerships. And so observerships are essentially what observer, but in that name, you see the word observer. So you're truly observing, and you're mainly accompanying the doctors in whatever they're doing, whether it's an outpatient or inpatient setting, but you're shadowing. And although that's not as ideal as something hands-on in an academic institution, many times that's the only type of opportunity you would have if you're an international medical graduate. Now, there are some institutions where you might be able to do what we call an externship. So an externship generally refers to a hands-on experience for an international medical graduate, somebody who's graduated, who can then do something hands-on. Most of these opportunities are outside of these academic institutions. They can occur in hospitals, they can occur in outpatient practices, but they do allow you to take histories, to present cases, to access the EMR, to write notes. And what you're trying to do with your US clinical experience is secure experiences that will allow you to do the things that you will be expected to do when you're a resident. So the residency programs want to know that you can take histories and you can examine patients and you can present cases and you can enter notes in the EMR. Of course, you all will be able to do that. You will get that type of training in Brazil or whatever country you are residing in. But what the US residency programs are looking for is evidence that you can take those skills and apply them in a US context. So when you do your US clinical experience, you're providing proof that you are capable clinically of being successful as a resident. And so that is what you're trying to do, is to secure the right type of US clinical experience that's going to strengthen your application. I'll stop there. And Bruno, do you want to add on to that or comment on some tips? And I'll also offer some tips as well for success.
Yeah. So this is having a US clinical experience is crucial, as Samir outlined. I think, if I can put like on a bumper sticker, the importance. It's something like, one of the quotes that I've learned after I moved here to the US, started my residency, was in God we trust, everyone else show me data. So I'm pretty sure that if you're coming from Brazil, or if you're coming from India or China or Nepal, and if you have some letters of recommendations from people from your institution telling that how great you are and how professional you are, I think that's great. That's amazing. But what the program directors here want to hear is that given like the same conditions of pressure, temperature, and everything, putting you on an environment that is pretty much the same as a fourth-year medical student, would you be able to function well? Would you be able to, kind of take part, on a multidisciplinary team and communicate well and present cases and write notes effectively? And the way that the best way, to prove that is by taking part into hands-on, clinical active in the US. And MD2B, as Samir mentioned, is great, at that, and offering a good, like, one-on-one, kind of mentorship, mentor-mentee kind of relationship, with one of their attendees. And on the left, so the letter writer can pretty much tell in the letter that you were able, to see, like, such a number of patients every day, and took history effectively, and whatnot. And that's kind of this piece of evidence, that the program directors will be confident about of inviting you to their programs and taking you as part of their residency program. So they'll have, like, this kind of peace of mind, that you're going to be there and going to be functioning, as a resident. Without that proof, it's really hard for you to, to compete on par, with the other American medical graduates, and there are, like, multiple opportunities, right there. I mean, right now, compared to how it was like 10, 15 years ago, things had kind of narrowed down. Most programs nowadays, they want you to be, like, in your final year of medical school. If you're not coming from an English in which if you're coming from a country in which English is not the first language, they want some proof, that you have adequate English level, meaning that, they want you to have, like, a TOEFL score above as such, number. They want you, to have taken, like, your USMLE step 1. And that's it. Some places, they have tuition, some places don't have. If you're a medical graduate, so it kind of narrows down your chances. There are, like, some opportunities, to come here as an observer, in which you're going to be, like, shadowing and being part of the team. It's a little bit harder for you to pretty much kind of outshine other students if you're not able to present cases, and whatnot. But there are people that were able, to secure good letters of recommendations, from observerships. And what they did was, if the team was, like, presenting an interesting case, they could offer the team, to give a talk, on that specific topic. And that's just something, that would go on the letter of recommendation, So, oh, this student, gave a presentation about this topic on a patient that we saw. And this is, like, some evidence that you have, like, good communication skills. You're always, like, seeing interesting cases. So some people were able to, like, present, like, case reports in conferences or publish some interesting, case reports. So you can offer, to write, some case reports and even, like, being in an environment, like, especially, like, some of those university hospitals, it's also a great way, to connect and network and open up opportunities, for, like, a clinical research experience in which you could also, further develop your CV and further foster relationship with a mentor, that can be helpful in advancing your career and advocating for you whenever you're going to apply.
Yeah, I think there's a very interesting question from the audience, and you partially answered this. But it would be how to maximize the observership experience, especially in surgery, because in internal medicine, there's often round discussion, diagnostic investigation, etc. But I would say, like, in general, how can someone maximize this experience? Because observership, like Dr. Desai said, you basically observe. So what can you do there? So to cause a good impression, so in the future you can have a strong letter of recommendation? What would be your advice or tips to maximize the observership?
That's a great question. It's such an important question that I devoted an entire podcast episode to this topic. So we have a podcast called Success in Medicine, and you can access that at different places. But if you go to our website, thesuccessfulmatch.com, and you click on podcast, you can search for observerships and you'll find that podcast episode. But to answer that question, Diego, when you're an observer, you have to look for ways to let them see how much you have to offer. And yes, to some extent, you're restricted because you don't have the opportunity that someone who has been given permission to do hands-on work has. But there are numerous ways to take some initiative and show them what you have to offer. So for example, Bruno mentioned one of them, which is offering to give a presentation. Now, some observerships may require you to give a topic presentation, or if that's not a requirement, there may be attendings within that institution that feel strongly about having their rotators and observers give a topic presentation. So that may be built in, already established within your ship. But if it's not, you should have your eyes and ears open for an opportunity to talk about something. And that happens almost on a daily basis, because if you're rounding with the team, something will come up which is interesting, or some clinical question that is unanswered or requires further investigation. And as the observer on the team, you can take the lead in researching that topic and then giving a short presentation afterwards. So that's an example of how you can take initiative related to presentations. Now, other ways you can do that is if you want to show the team and you're attending how well you document notes, how well you write progress notes or admit notes. Even though you don't have access to the EMR as an observer, you can always take a piece of paper and write your own note. And you can then submit it to the residents or to the attending physician for feedback. And in essence, what you're achieving by doing that is you're going to be growing in your ability to do those things. Also, you're going to be making an impression on the resident or the attending through what you're submitting. So this is a chance for the attending to write in their letter recommendation that I had an opportunity to review, Felipe's notes, and I was quite impressed. So they can say something about your notes, even though it's not an official part of the EMR. So you're looking for opportunities like that, even case presentations. So let's say you accompany the resident to a patient's room and you have watched him take the history, you've watched them take do the examination, and maybe the resident has shared some of the test results with you. Well, as a surgery observer, you can take that information and take a little time to put together a case presentation, and then during attending rounds, when it's time to discuss Mr. Smith's case, instead of the resident giving the case presentation, you can jump in and do that with the resident's permission. And now you have an opportunity to showcase to the attending that you have these skills as well. So thinking about how you can integrate yourself with the permission of your team so that you can showcase these things that you've already worked on in your country, and now you can show them that you know how to do it in the US.
These are great ideas. I've never saw. I love it, Dr. Desai. Really, really good ideas for international graduates. You have to find a way to show people, your skills and try to impress your team to get letters of good letters of recommendation. Bruno?
Yeah, I mean, I think these are amazing ideas, and I think what Dr. Samir is trying to say, in other words, is you need to be creative, right? And just try to make the most of the situation. But this is, simply talking about, trying to get or try thinking ahead, and thinking about how your letter of recommendation would look like, and okay, so how can I have the attending, to have the evidence to comment on this or comment that. And I think that's kind of a good creative way of doing this. The challenges, and this is, for me, like, coming as an IMG, I did many months of rotations. I started with, a couple of months of observerships, and then I did some hands-on clinical experience when I was a last year medical student in Brazil. But, as an observer, just coming directly, from a different country, problem is you don't understand, the etiquette, of the team. So you tend to kind of, be a little shy and tend to just, be like muted and just kind of smile. And you don't show, you're not comfortable enough, to show your personality. That's why, this opportunity, with Dr. Desai, with MD2B, if you had the opportunity to like go to like a university rotation, like a university observership, let's say in a Cleveland Clinic or I don't know, Mayo Clinic or any of these places. But before, if you had a chance, to have some like hands-on experience like that, that Dr. Desai provides, you would be prepared and you'd be more confident to give a presentation or to what it'll be expected. So you're going to be more prepared and you're going to be more. I would say like more confident and more comfortable with the etiquette, that the team, and the rounds, and whatnot. And lastly, every opportunity that you have, if you're going to like, a university place or like a big, institutional place, just like being there, take advantage of all of the conferences, all of the like morning conferences, noon conferences, evening conferences. Go to everything that you can, shake people's hands, exchange business cards, present yourself, and have like an elevator pitch. Have like this kind of 20-second way of telling about who you are and what you're doing there. And shake different like people's hands and use that opportunity of the observership, not only like on the opportunity itself, but as a bridge, for something else. Like, these people that like, work on that hospital, they sometimes, they know someone who with a similar background as yours, or, it's all about networking and all about like, presenting yourself and making sure that whatever you have, the piece of paper that represents you, your CV, you're with through like, this kind of networking, you can pretty much make that into like an opportunity to turn you from a piece of paper to like an in-person, face-to-face conversation.
Nice.
If I can just, Diego, if I can just comment on something that Bruno said. Your decision of where to rotate first, the first month or two of your US clinical experience is really a crucial decision. And to give you an idea of why it's so important, I want to take you back to my third year of medical school. Now, I was a US medical student. Okay, so I was born and raised here in the US, and my first two rotations were family medicine and psychiatry. And even though I'm used to the US healthcare system, and I had 2 years of medical school and the basic sciences completed, my first two rotations were a struggle. And that wasn't just me. That's every new third year US medical student has the same experience. I see it today in my Baylor medical students who are starting their first few rotations. And the reason I'm sharing that with you is it's hard for everybody. It's very hard, right, for international medical students and graduates, because the difference between me and you is that, I've grown up here, so I have an understanding of things that you haven't yet seen or you might be experiencing, right, for the first time. And so there's a adjustment period. There's a learning curve that's a bit different for everybody. But the point that I want you to take away is that you cannot expect to be at the top of your performance in your first rotation or two. And so you'd rather not set up your first rotation or two at a rigorous university type experience. Because if you only have, 3 or 4 months to give for your clinical experience, and in the first 2 months, you may not be showing your true abilities because you haven't fully adjusted yet. And so what we do at MD to Be Connect is when people come to us and they're interested in our rotations, and let's say if they're a graduate, we tell them, we think it's a good idea for you to get some university experience. It may be that you can only land an observership, but we think that's very valuable. But before you do something like that, do something that's not going to be so pressure packed. Meaning when you're in that observership and you're within a residency program, you feel that pressure to perform because it's a chance for you to get noticed, a chance for you to possibly earn an interview. And you can have a real chance to earn an interview with that type of experience, but you want to do it at a time where you're going to be more comfortable and confident in your abilities in the US.
Amazing. Yeah, that's a really good strategy, like to when you are still adapting and before you, yeah, I really love this idea. I agree with you. And we are getting to the end of our discussion. I want to ask you to last question, and then we're going to do the book just for the people that are here. So a lot of people now, they're preparing their personal statements for the application. A lot of people that are here watching us, they are right now struggling writing their personal statements. So what would you what would you recommend for them? What would be the best strategy, or what are the common mistakes they have to avoid in their personal statements? What would be your advice for these applicants that are right now struggling to write their personal statements?
Personal statement is one of the most difficult, if not the most difficult part of the application for most applicants. It creates a lot of angst, a lot of anxiety. So I can totally understand that people are worried about it and thinking very deeply about it. So one thing that I would tell you with respect to the personal statement is that you all are very unique. Nobody has lived the life and the path that you have lived or have been on. And so through that journey, there is going to be some very distinctive things that you've experienced that are going to resonate with a residency program. And what you're trying to do is find those types of experiences and stories. So really, before you get too far into the process of writing a personal statement, you need to do what I would call taking an inventory of yourself, okay? And what you've done, like what are these notable experiences? And I encourage my students to ask themselves a series of questions. And for example, those questions could be things like, why am I interested in this specialty? What experiences have led me to discover that this specialty is what I want to make my career in? What have been the most meaningful moments in this specialty? What are the qualities and skills that I've been able to develop that would make me a highly competent practitioner of that specialty? So there's different questions, and on our website, thesuccessfulmatch.com, there are blog posts that we've written about some of these questions and things that you want to brainstorm. But what I encourage all students to do is just write freely about these questions. Don't restrict yourself at all. Just take a question and just write 2 or 3 pages. Just whatever comes from your heart, whatever comes from your mind, because you want to get all that out, because it's far better to start with a lot of material and then to think about what you want to do with it than to try to just sort of write the perfect personal statement in that one sitting. So one of the pieces of advice is that it is a process. It's going to take multiple drafts, but you don't want to skip some of those early parts of the process where you're remembering about the things that could possibly be powerful content to include. Beyond that, I will also say, before I hand it over to Bruno, is how you start your personal statement is very, very important. So these residency program members of the selection committee, they have a short amount of time to go through these applications. And the personal statement is going to be one component of the application that they're going to take a look at. And what you're trying to do is you want to catch their attention right from the start. And if you start strong and you have something very captivating in that first paragraph, you have done what we call hook the reader, meaning you have grabbed them, they are with you, they want to know all about you, and they're going to be with you through the end of the statement. That's what you're striving to achieve with that first paragraph. And if you can achieve that, that's going to go a long way to convincing the reviewer of your application that you are somebody that they must absolutely meet in an interview. And that is what you're trying to do in a personal statement. I will tell you that most statements that are written are what I would call neutral, meaning they're not great and they're not bad. They're just in the middle. They're so-so. But all of you are special. You are unique. You have so much to offer, and there's nothing so-so about you. So we have to find those things that make you special and make sure we get it across in the personal statement so that it makes the interviewer say, I must meet this person.
Very nice. I use the catchphrase in mine. My personal statement started with me and Yo are in Japan during an earthquake. So I picked they were curious about reading till the end. But Bruno.
Yeah, no, these are absolutely fantastic comments, by Samir. I think, the central comment, in terms of personal statement is, first, you need to get feedback, multiple feedback, especially, from your mentors. Take the opportunity of, coming here to the US and connect, with multiple native English speakers, multiple attendings, residents, med students. Use them, so they can critique your personal statement. The other thing is keep it short, keep it to 1 page, because of what Samir was telling you about, in which people have very limited time and a very limited time span and attention span. So don't write more than 1 page. And this is something that, for me, came from my main, mentor, in the process, which is Dr. Residency, who is somebody who pretty much earned he earned the prize of best teacher in Johns Hopkins Medicine, for most consecutive years. It's just amazing, how great, he is. And I really recommend you all to read this paper called Rocking the Match. It's available freely over there, in which he wrote and he put his perspective. But keep it short, 1 page, get lots of feedback. And most people ask me about making their personal statement memorable. When I asked Dr. Residency about that, he told me that, well, I had a few memorable personal statements, but they're not particularly good. So memorable doesn't necessarily mean like a great personal statement, because some of the most memorable personal statements are just like terrible. So like it's okay, you know, to have like a clean, professional kind of personal statement, but what Diego said and what Samir said, you know, about, you know, starting big, you know, starting with something that would catch the attention of the reader, you know, it's really important. The other thing is that, you know, things need to be connected. The first paragraph needs to be connected to the second and third, you know, and so forth. Also, don't keep just, you know, throwing up your CV over there. Your CV is your CV. Your personal statement, you know, you can put some elements in explore, you know, some elements, you know, over there. But I would avoid just like recounting your CV over there. It's not the place for that, but it's a place for you to stand out and be something more than a piece of paper. Remember that, right? So your personality needs to show up there. And it's pretty clear what type of personality you have, if you're more extroverted, if you're more open to experience and whatnot, you know, based on what you write in a personal statement. You can infer a lot. If we can't, it means that it's not a good personal statement. So I want to see, like, you know, your personality there, you know, when I'm reading it. And also you're gonna tell a story, you know. So you know, Star Wars and Harry Potter, you know, all of those billion-dollar franchises, you know, what all they have in common is the hero's journey that Diego was mentioning before. So, you know, you start up at a place, you know, you go through like some struggles, you know, and get to like an end, a resolution, in which, you know, the end is like, well, that's why, you know, once you become a resident, you know, I went through like, you know, this kind of struggle here, and then, you know, this is, you know, what I did, you know, in the meantime, during med school, and this is how I learned, you know, why I want to do like medicine, why I want to do surgery, or why I want to do this or that, and try to answer those questions. This is how I, you know, get to came across like the idea of going to the US, of leaving my comfort zone and kind of, you know, going there. So use like, you know, this kind of hero's journey, you know, structure. And again, lots of critique, you know, that. And lastly, there's one last thing, you know, that I was about to say, you know, about the personal statement. Oh yeah, so that's the Chekhov's gun. I love the Chekhov's gun. So that thing about keeping things connected, you know, it's really common for people to send me personal statements, and, you know, they start in the first paragraph, they talk about like, you know, their grandma that was sick, you know, something like that. And then there's nothing like, you know, connected, you know, there's nothing, they never bring up, you know, like the sick grandma again. I was like, what happened, you know, to that sick grandma? So Chekhov, Anton Chekhov, one of the greatest, you know, Russian authors, you know, he had this principle of the Chekhov's gun. So if he starts talking about like, you know, a room that has a gun in the first chapter, it means that like, you know, by the third chapter, somebody will get this gun and shoot someone, you know. So anything that you put in needs to be part of a context, you know. You cannot just like, you know, throw things in the air. It's fine in the beginning whenever you're starting to write, but that's why, you know, it's important for you to get lots of critique and implement, you know, like those changes, so everything is connected, everything is concise, and you kind of come across as like a sane, you know, reasonable person, and you know, that part of your personality needs to be there. That's pretty much it.
Very nice, very nice. I think now it's time for us to do our raffle, and then we go to our final considerations. Fabricio, are you there?
Here I am, sir. Very good, very good. Thank you, gentlemen. So we're gonna do a raffle here. Very expected one. Thank you all for being with us now. And to be fair with you that are participating, we have a criteria here. So despite the fact that we had over 200 subscriptions, we're going to raffle only between the participants here. So we are now in 62. The dynamic of it happens in sometimes in a funny way, because we do the raffle and comes and pops up some names from people that are not here. So we go for the next one and the next one and the next one until we get someone who's participating right now. Good.
Yeah, so please, if you are here, if we say your name, just let us know that you are here.
Yeah, Diego, the mics are blocked. So I may ask you a favor, and to Bruno as well. If you could scroll in the chat and find the person, would be very helpful.
The person can kind of just type in the chat and say.
Sounds good as well. Good plan. So everybody, hope you can see my screen. Can you see it?
Yes.
Very good. I swear all of your names are here. I won't read each of them. Over 200 names. Here we go. Hopefully we get the first one. Boom. Deborah Moreira, are you with us?
Oh,
He's here.
All right.
He's here.
Yeah, she's here.
That's not common. Bullseye. Ah, there she is. Yoo-hoo. We saw her here. So very good, very effective. Lucky girl. So Deborah,
Congratulations.
we're gonna receive a very special book, The Successful Match. We're gonna send you to your address. So keep in touch with us. We're gonna get your address and everything to mail straight to you. Congratulations. Diego, handing back over to you for final considerations, final statements, and from my side, thank you again, gentlemen. It was great. Not sure if you had a chance to check what we've been discussing in the chat. Very good questions. Some of them we could not answer. I mean, many questions popping up here, but we're gonna answer all these people through WhatsApp, through our MedUSA and MD2B Connect channels. I'll make sure Alisa and I will treat everybody in a very special way.
So Fabrizio, what about that? So what about, if you compile, these questions, like, I can, or either me or Diego or even, Samir, we can, record kind of a quick, video and you can post in our social media, right? Like as a for reels or, something like that. So it can be, I can totally do that, but I'm just saying.
Very kind.
If there is anything.
That's, by the way, a great idea. Let's make, we're going to make both ways, and let's make
and
the reels run it. And
also, please, I don't know if you can, just share like the screen again, with like MedUSA and MD2B with the social media, so people can subscribe. This is very important. Dr. Samir Desai is a very busy man, very he's very kind, to donate, his time, to kind of be here with us. And what we ask you, to do is, just to follow us and share this, with your friends, with your like WhatsApp groups, with your, within like your university or within your interest groups. And MD2B is just like an amazing a company that I pretty much, was life-saving during the pandemic. It was pretty much one of the very few opportunities that were still open during the pandemic, for international medical graduates. And that's how I came to get to know Samir. And I thank you so much, for him, to be here today.
Yeah, no, thank you, Bruno. Thank you, Diego, Fabrizio. It's an honor to be with all of you, and to our audience, I've really gotten to know Bruno and Diego very well, and I hope you can sense from our conversations today just how passionate we are about the future of medicine, because really you are the future of medicine. And there were people in our lives who were there for us, mentored and taught us, and continue to mentor and teach us, and we all feel so strongly about the future of our profession. And so if we can pass along some of the things that we've learned through our careers to you, we're excited to do that. This is a way for us to do that. I thank the whole team at MedUSA for putting this together, and look forward to hopefully connecting and meeting with many of you in the future.
Thank you, Dr. Desai. Thank you for your time, for all the tips and advices and sharing your knowledge with us today. I think it was very helpful for everyone. Bruno, thank you so much. Also, it's always good to have this conversation with friends and try to help as many students and doctors as possible. And thank you for the audience. Thank you for everyone that joined us tonight. Like we said, we're going to try to answer all your questions on our social media. And I think that's it. Just one last thing from you too. What advice would you give to the ones that are starting the journey? Let's end with one advice from both of you to people who are struggling, studying biochemistry, and struggling to study for step one. What would be your advice to those international students?
So one piece of advice I would give you, this is what I give all of our future doctors, and it's something that no matter where you are in your journey in medicine, whether you're just starting off in medical school or you're someone like myself who's 25 plus years into their career, wherever we are, we always have to make sure that we're taking care of ourselves. So we need to make sure that physically, mentally, emotionally, that we're practicing good habits, because when we do, that changes things, right? In the way that we handle the challenges of medical school. So no matter where you go to medical school, it's hard. It's very difficult. If you're in the basic sciences, so much material to master. If you're studying for the USMLE and English is not your native language, there are so many challenges associated with that. And it can, create some difficulties, right? You feel the pressure. Sometimes there's stress, sometimes anxiety. And so what I want all of you to think about is, what do you need to do on a daily basis to replenish yourselves? For all of us, it's different, but whatever that is, you want to make sure you incorporate that so that you can move forward, because for the whole rest of your career, you're going to have this fantastic opportunity to care for patients and impact the lives of those people and their families. And it's a tremendous privilege. And in order to do that to the best of our abilities, it all comes down to how we take care of ourselves. And it's also essential for our own well-being. So for those of you who are in your basic sciences, we've all been there. We know how hard it is, but we want you, to definitely take care of yourself. I will give one other tip that I learned from Bruno about if you're a beginning medical student and you're in a different country and you're not quite sure about US and whether to train here. Bruno shared some very sage advice with me on one of our meetings, and he said that it's so important for people to try out the US. And I think that is an amazing piece of advice that I'll let him tell you more about.
Oh, thank you so much, Samir. I'm very, very flattered, with that. If you go to this successfulmatch.com, website, you're going to see a podcast that we recorded a couple of years ago, and that's what I tell Samir. That kind of work for me. So I think if I like to get those short bumper sticker phrases to that people can carry along with them and don't lose sight of what's really important. So first you need to understand that happiness, it's so cheesy, but happiness is a journey. It's not a destination. Okay, it's not that you're going to get to the US and become a resident, you're going to be happy. No, there's always something else. So you better enjoy the journey. Okay, so happiness is a journey, not a destination. Okay, so you need to enjoy the journey by having like a great social support, having like a great doing things that you love, And if you don't love biochemistry, at first, that's fine. But you might find something within medicine, that you like, that you love and that you enjoy doing every day. Because essentially, you need to learn how to love, your day to day, how to make the most, out of people who are, around you, and respect them, and again, have fun, learn how to have fun, not only with medicine, have other aspects, besides medicine. And in terms of coming here, I think, that we rarely know what we're going to do, what we want, what we like until we try something. We need to pretty much have an open mind and try to, try new experiences, and try to see, if it's something that appeal, to us or not. There are many challenges of coming to the US, so you need to be absolutely sure about that. And in the end, there's no objective data or a number, or because the US doctor make this much, more than. Yes, but there's always a trade-off of being away from your family and this and that. So you need to try out, and eventually it's a matter of gut feeling. So for me, the process of coming to the US became clear when I was like 15, 16. I was, spending a couple of months, in Tennessee, learning English. And during the weekends, we would do like, short trips. We went to DC. That was 2001 or something like that, 2002, 2001. When I sit ground on DC, and when I saw the city, it's just like, beautiful, like downtown DC. I can't explain, but it's just a gut feeling. I just felt like at home. And it's something that whenever you are here, if you have that strong, gut feeling, that's a sign, that you're probably on the right path. So if you're unsure, sometimes you just need to try out. Some people might come here, might hate it. That's good information. That means that, well, I tried, this is not what I want. But at least that you don't want that. And you're not going to be like contemplating or having like, some kind of frustration in the back of your head that, you lost a time window that you could, come here and, follow your dreams. But if you come here and if you love it, and if it's within, your gut feeling, that's great information. Use that and direct, what you're going to do, your trajectory, to your goals. And that's my piece of advice. Okay, learn how to have fun during the process. It never stops. There's always something new.
There's always something new. And like I like to mention the Brazilian volleyball former coach, Bernardinho. It's not just about the will to win, like to be a champion, to get gold medals, but the will to prepare, to wake up every day and study really hard. Because passing your step one or matching, this will be a consequence of all your efforts. So, Dr. Desai, Bruno, thank you very much for your time tonight. I'm honored to be here with you. I'm very happy, and I think that's it. And everyone in the audience, thank you so much for joining us tonight.
Thank you, Diego, and wish everybody in the audience all the best.